Colleen, regarding your question, number 7, I do think physicians are typically seen as the leaders, as they typically write the orders. However, I do not think that a person typically needs to be a physician to be the leader, because I think there are more clear qualities that the book talks about, such as respect, being able to have connection, being able to support others, and being open to all members' teams for suggestions and values, and commitment to health of all the individuals are very important to be a team leader, and most of the physicians I know do have most of these characteristics. I think as if you're someone working on a team or you want to be on a team leader, it's important to remember to use these aspects. I like how you kind of talked about people being on the lower end of the totem pole might not feel free to speak up. I did have experiences with on my clinical recently. One of the surgeons wrote a script that was clearly miswrote. I'm not sure what happened, but a lot of the therapists did not feel comfortable addressing it, and were going to provide treatment to this patient regarding the script, even though they knew that there was a large possibility of harm to the patient. They followed the script. So one of the elder therapists went and double-checked with the surgeon, and he realized that it was a SMIC and everything was cleared up. But had she not felt that he was open and connected about that, she may not have approached him, and it could have ended up with worse care for the patient. Regarding the eat-in alternatives, I also do think that autonomy is huge in the healthcare setting, especially for older individuals today, as that population is increasing. I know that I had a field work in a skilled nursing facility, and a lot of the complaints were that they didn't feel like they could be themselves anymore. They didn't have choices. They were told what to do. So kind of just allowing your patients to have most autonomy, giving them their options and letting them choose is so important. And regarding your second question, I do think that knowing the roles of a pastoral counsel for more psychological intervention in long term, whereas a spiritual director is someone looking more for guidance to where they want to go, maybe after a serious life incident, they just don't know where they want to go. I think knowledge of these referrals kind of provide us with options to provide to our patients. And we don't necessarily have to make that decision for them. We can provide all these options and let them see who they feel like would help them the most. So don't shy away from referring someone to a spiritual director just because you feel that a pastoral counselor may be better for them. I think it either could help them with their spiritual healing.